Hey, my name's Matt. I'm from Toronto, Ontario, Canada. Um, this video, I guess, is about or for um, young people with rheumatoid arthritis. I guess people that have just been diagnosed in the early stages and they're wondering what to expect in the next couple of years, I guess. Um, I'll tell you a little bit about myself first and discuss other things later. Um, I was diagnosed with rheumatoid arthritis when I was 24 years old. I first noticed the pain, I think it was in my lower back, then in my toe, and then boom, like it really creeps up on you. Like for me, it did. I first noticed rheumatoid arthritis in bigger joints. I think my rheumatologist told me that usually it starts in the smaller joints and then works its way to the bigger ones. But I noticed it in my bigger ones first. It has crept to my smaller ones now. So I went to go see my doctor. He took a blood test. The rheumatoid factor was high. Sent me to a rheumatologist. Yeah, I got it. They put me, what they do is they sort of put you on a bunch of stuff right at first, and then if you start feeling better, they wean you off some of the stuff. I was taking methotrexate, which is a self-injection. I give myself once a week. Anti-inflammatories, I've used Neopraxin, Meloxicam, Celebrex, Plaquenil. I'm not sure if Plaquenil is anti-inflammatory or not, but I was taking Plaquenil. For the first, I think it was like a year, it worked for me. But with the medications you take, it does lower your immune system. And I think swine flu was going around at that time. And I decided to stop my medication, which was dumb. Because, I mean, 9 months after I stopped, I felt good. And then all of a sudden, it came back. It came back really bad. And it's almost harder to, well, not harder, but it takes a lot more time to get you feeling better again. With the medications, like when you're not on medication, like RA is crippling. With the medications, some people feel 100% better, some people feel 80% better, 50% better, some people don't feel better at all. So, but there's a lot of different kind of medications that your doctor will try. The only problem is with some rheumatologists, I mean, it's every 3 months that you're able to see them. So like you'll try a new medication and it's not working. Well, you got to sit around for 3 months and wait until you can see them again and try different things. So that's a possibility. Be prepared for that. I take Tylenol too. Not Tylenol too, but I take Tylenol as well. Extra strength. Yeah, it sometimes helps, but I notice it hasn't. Painkillers, don't expect to get painkillers. I don't think most doctors do that. But hopefully the medication will help. And remember, if you're going to go off your medication, talk to your doctor first, because it'll suck when you're off it. Excuse me. Also, depression. Watch out for depression. Like it took 4 years, and I was good with it. I had accepted it. I wasn't gonna let it get me down, but after a while of being in constant pain for like a year straight, at its worst, it snuck up on me. And I started feeling depressed. I started neglecting people, friends, family. Just wanted to sit around and do nothing. And then finally I was like, you know what? No. So I went and talked to the doctor, talked to a psychiatrist, got on some antidepressants that worked, and made me feel a lot better. And actually made me realize, like, don't don't sit around and try to pity party yourself and make people feel sorry for yourself, because that's another thing. People don't get the kind of pain you're in because they don't know what it feels like. You know, you'll be hobbling along and people are like, come on, hurry up, do this. You know, like, they don't understand. And they won't understand because they don't have it. You know, they could sit there and read everything they want about it, but unless you got RA, you know, like, I know your pain because I got RA and I know what it feels like. People that don't, they don't get it. So, you know, don't hold friends accountable or lose friends because you don't think they understand. Well, it's hard to understand, because when I didn't have this and like older people had arthritis, I was like, wow, whatever, you know, like, can't be that bad. And yeah, now that I got it, yeah, it's pretty bad. So remember that, you know, don't lose friends over because they don't understand. It's a hard thing to understand because, you know, like, unless you're feeling it, you don't know. Also, there's going to be a lot of things from now on that you can't do that you did before, you know, like playing sports, running, stuff like that. You know, I still try to get involved. I play beer league baseball in the summers. Just the back catcher, so I just throw the ball back to the pitcher, and then when I do get up to bat, I hit the ball, I run to first, and then I have someone run for me. You know, you can do stuff like that. I'm also a hockey guy. I still play hockey, but the last year or so I couldn't do it. But, you know, still get involved. You know, like, whatever you do, don't just sit in your bed and have a little pity party, because it's not worth it. It's not worth it. You'll 3 years later, you'll be like, man, like, I just wasted 3 years of laying around because I'm feeling sorry for myself. You know, take some pain management classes. They help. They really help you cope with, you know, the pain. You know, you're going to be in pain. You're going to be in pain. And I not 100% sure, but like, even on the best medications, I don't know if you're going to be 100%. You know, you might be 80 or 70%, but you know, you're not going to be your normal self again. So you need to adjust and learn to cope with that. Naturopath. Try naturopath. You know, like, give the medication a try first, but if it doesn't work, you know, go see your naturopath. I personally should be doing it, but I haven't, but I'm looking into it right now. It is a bit expensive, but you know what, if you've got some money to do it, because it could help you out a lot. Work. Make sure your employers, you know, print them out some stuff on it, because just like other people, they don't know what it feels like. They don't know what it does to you. You know, there's going to be people that walk up to you and say, oh, I got arthritis in my neck. Yeah, that's osteoarthritis, dude. It's not rheumatoid arthritis. It's totally different, okay? Your little osteoarthritis ain't nothing on what I got. So make sure they're informed on what rheumatoid arthritis really is. It's an autoimmune disease, you know? It's not wear and tear of the joints over 60 years or whatever. So make sure they're on the same page as you, because it'll help you a lot with work. You don't want to lose your job because of it. You know, like, they need to know. And just stay positive. You gotta stay positive, because if you don't, you know, you have to accept this. You've got it, and there's no cure for it. And if you just dig yourself a hole, you're gonna dig it too deep, and it's not worth it. It really isn't. You know, like, you can still go out. I still go out all the time. You know, I hang out with my friends, go see my family. Yeah, I'm in pain, but deal with it. You know, I know it's a crazy reality, but if you don't just deal with it, the other option is probably not one you want. So just leave some comments underneath of if you guys have any questions or anything like that, and I'll post another video. But I hope that was informative for you guys. Guys, the future's not bleak, okay? It's manageable, and you can still do stuff. So anyways, take care.